Today is Monday, May 20th, 2024, and I'd like to bring to order the Douglas Board of Health meeting. And first and one and only agenda here, on the agenda, we have Jenna Gowan, did I pronounce that correctly? And Emily Whitaker. Very nice to see you folks here. Where do we go from here?
Just if you want to ask them any questions or...
Okay, yeah, I guess we'll open it to questions. And
So Jenna is the community health worker.
okay,
So my focus in town is going to be working with individuals that have underlying untreated or poorly treated mental health conditions and substance use disorders. However, that is not exclusively the only population, that's just one of the primary focuses. So I will be able to work with anybody, any family that just has a need to connect to local resources, services. So to do that, I've already started dabbling in town. I've met with the police department, I have met with the fire department and EMS, I've met with the senior center. So just kind of hearing everyone's take on what the biggest issues in town are, and then trying to deploy how I'm going to assist. Because
Okay.
depending on the organization, will really kind of depend on what services they have in place and how I can collaborate. So my efforts will be more often than not very collaborative in nature.
you must be a very busy lady.
Oh, you have no idea. You have no idea, but yes. So,
So, questions. We are a small town, as you well know.
gathered.
Yes. However, that doesn't mean to say that we don't have our own issues as well. And maybe sometimes they're more pronounced in a small town. So you would be of great value to us, I'm sure.
I certainly hope to be.
Well, you come to us with certainly a very impressive resume.
Thank you.
And that's something that we really can use here in this town, for sure.
Yeah, I'm very excited.
Lori, you have anything? No?
I'm all set.
You're all set.
It's a relatively unique position, so if questions do arise down the road, feel free, reach out,
Okay.
let me know.
We have some community buildings around the town. So we have, apartment complexes.
Yep.
We have, and would you be reaching out to them?
Oh, I already have meetings
You have?
scheduled with them for this week.
Okay.
Yes.
How about churches, religious, that kind
Yep,
of
so
thing?
churches are on my list. They're just a little further down. I work in order of prioritizing. So my larger stakeholders like police, fire, EMS, and senior centers and school resource officers.
School resource, yeah.
Yeah, we're at the top of my list.
Oh, sure.
Now I'm getting down into food pantries, housing, and churches.
Oh, okay.
So-
Like I say, you're a busy lady.
Yes, so I will be visiting Hayward Landing on Friday morning to chat with them about their residents, and I've already made contact with the folks at Riddlebrook, and I think we have something scheduled for next week. So hearing, their resident population, what their needs are, and how I can collaborate with their staff. Because it sounds like they already have some staff in place that might be,
Right.
working on supporting residents and connecting them to resources, but I can be of an added resource to them.
Okay.
And I've made connections with Oasis here in town as well, and just kind of chatted with them about their program structure and their model. So I've got a good handle, I think, on what's
Great.
happening.
That's
So the
great.
fact that the town is
Sounds it.
small works to my advantage because I can cover.
It does, it really
Yeah.
does. However, small can also be, like I say, it can be challenging
Exactly.
because you're dealing with people who, well, obviously, most people know each other from the town.
Of course.
And
Of course.
that can be difficult to be discreet sometimes.
Of course.
Yeah.
Of course. So, but glad to be here.
I'm not sure, but I think
Oh, I'm sorry. Hi, Dave, how are you? Mary Ellen,
Good evening.
how are you? Do you have any questions for the young ladies here?
Can you hear me?
Yeah.
Yes?
Yep.
We hear you fine.
Great. Excellent. Sorry I wasn't able to make it there in person this evening. Looking forward to meeting you in person at a future event. I was wondering if there would be a possibility further down the line for you to present some of your, some of the resources, some of the things that you've been working on in our community, not in the immediate future, but, maybe we could plan it in a few months from now or something where we can, dive in a little deeper into some of the issues you've been hearing about, some of the resources that might be available. Certainly I think, as a volunteer board, I think we're all interested in helping our community, and I'd be interested in learning more about, what are some of the issues that, our residents are facing, what are the resources that are available for them. I think it'd be good for us to have a little bit more, more detail on some of those issues.
Absolutely,
No.
and I can happily,
No,
as
this
I'm
is just
uncovering things, I can
added.
also draft kind of a report, if you'd like a summary of kind of
Yeah.
what different organizations and resources, kind of what they're identifying as issues, I can
He's still
happily
working.
kind of formalize that and make sure that you get a copy of that. Because I'm keeping,
That's great.
yeah, I'm keeping some notes and stuff for my own reference, but I definitely can take that and make sure that you all get a copy, so.
That'd be great. I'd appreciate it. Thank
No
you.
problem.
If I could,
Yep.
he mentioned resources that are available. I think we'd also like to know resources that would be needed
Yeah.
or not available.
Yep, absolutely. And it's interesting too, because what I've discovered thus far in the last 2 months of my employment, different towns do things differently. And I like to use Uxbridge as an example because they're a pretty well-oiled machine over there. They have several networking groups and committees that they have running that are really for the purpose of identifying what those gaps are in their own communities. So as I'm uncovering this, I can definitely formalize and kind of let you know what other communities are doing to see if maybe that's something that we want to explore in terms of like identifying those gaps and what else may be needed.
Hi, Mary Ellen.
Hi, how are you?
We're fine. Would you happen to have any questions for the?
I just agree with what David said and what, just the idea of us kind of understanding what you're coming across, in the community. And where will your home base be? Which is probably a crazy question because you've been everywhere.
Yeah.
But will your office be?
So my home base is the Northbridge Board of Health, which is at 1679 Providence Road. However, my work in the course of the day just takes me to many different organizations, so I am not stationary in an office. I use it as a meeting space when, I'm in the community and I have someone that wants to meet with me, just like I do here in Douglas. I come into the Board of Health, to work on different projects and stuff with Agnieszka, because we are already brainstorming and have some ideas about some things we want to tackle. So my work really takes me everywhere. So that's a tough one, but technically my home base is the town of Northbridge because they are the keeper of the grant funds.
Excellent, thank you and welcome.
Oh, thank you. It was so great to meet you guys.
I have to admit, we are great people.
I'm liking what I'm seeing so far, so.
Any other questions?
I don't have one.
Okay.
I don't have anything.
Okay.
I'm sure.
This is, he's a school teacher and a musician.
Oh,
Imagine that, and a farmer. He has,
A
oh,
little bit of everything.
that's right.
I love it.
So I
That's
think, we'll probably generate some questions as things progress.
Oh,
and
absolutely.
As issues come up and
Yeah.
as things happen. They'll surface eventually.
Are you a teacher here in Douglas?
No, Milford.
Okay.
Yeah.
Middle school.
Oh, my goodness. Okay.
Yep. Fun gig.
We're proud of our people.
Yeah.
And he's the young whippersnapper of the group.
Yeah, I take senior naps
During meetings.
during the meeting.
But when he's going, he's really going, I'll tell you.
Good.
Yeah,
Well, I'm looking forward to collaborating with everyone.
great, excellent. Well, if we,
And I think if you need help, any one of us would step in and help.
Perfect.
yes, oh, yes.
Okay.
Yes.
Good to know.
They will help you by saying, go talk to them.
Okay.
Okay, do we,
On to Emily, on, and then,
oh, I'm sorry, Emily, I'm so,
It's okay.
well, please, present yourself.
So my name's Emily Whitaker Smith. I started actually about less than a month ago, so I'm very excited to be here. I'm from the area. I'm from Northbridge, which is nice to be back in my roots. So I'm a regional health inspector. I do the 8 different towns through the grant. My home base is technically Northbridge as well, and I have an office there, but I am throughout every town. Throughout the week, I'm dispersed. I have a schedule per se for each month. So for example, this week I was in Northbridge today. I'm in Douglas tomorrow. Wednesday, I'm actually at a seminar in Marlborough. Thursday, I'm in Uxbridge. Friday, I'm back in Douglas,
Wow.
or back in Northbridge. So I'm all over the board, which is really nice. As a regional health inspector, I do inspections going from food, pools, summer camps, housing. Could be a nuisance of pest control, any sort of thing like that. I also do plan reviews for restaurants.
Okay.
What's my working right now? I guess my biggest project right now is summer camps. That's really my alley. That's my big thing in food inspections. But I'm very open to learning. I just took a 2-week course on housing inspections, so I'm really excited about that. So I'm really, I guess, all trades, which is nice.
So what towns are you affiliated with?
So the grant allows us to do Northbridge, Uxbridge, Mendon, Upton, Douglas,
Wow.
Hopedale, Blackstone, Millville.
Wow.
And that's the same for me as well.
So you guys go 24/7, period.
Yeah, yeah.
Pretty much.
It's great though. It's really nice. It's nice to be so involved in so many communities.
Sure, sure.
That's great.
It is.
It's great. It's great to have you guys available.
Thank you.
Yes.
There's certainly been, things in the past where we didn't have skilled people like that, or as skilled to handle these situations, and we do a lot of legwork, so it's nice to, I know when I was agent, it was just, one thing after another, it was just a lot of running around. It's nice to have you guys who know all those things. It's a great addition.
Yeah, that's for sure.
We're happy to-
That's for sure.
Thank you.
Any questions for you folks? Mary Ellen, Dave?
No, just welcome, Emily.
Thank you.
Welcome, Emily. I did a cursory review of both the CVs, and if I missed it, I apologize. Can you describe how much background do you have with the food inspections in particular? I know the other things are important, but
Sure. So food inspections, I've actually been unofficially a health inspector for the last 3 years. So I came from the town of Wellesley where I did an internship and I did food inspections. I did my practicum there. I worked part-time during my master's and I worked full-time there. So I've been unofficially, because I was doing food inspections as an intern, but officially for 3 years now. So I'm very well acquainted with food inspections.
Excellent. Excellent.
Yeah.
Good.
I would say that's one of my biggest domains that I'm very, very confident in.
Yeah.
It's good. It's good.
that's good because you may or may not be needed for that frequently. We've had some histories with some of our restaurants in town, and we would like to keep them all in a good place, so that way we don't have any backsliding. And I would like to say that that's a very important topic to my heart. So I appreciate your coming here with experience in that, and looking forward to working with you more in that and other areas.
Yeah, not a problem. I'm really excited to help with that. I will say my biggest thing with food inspections is I like to go in and I'll label a lot of the land, tell them all the negatives, but at the end I like to give positive feedback. I always leave positive at the end of my inspection because I want to make sure they're aware of what they're doing right so that they don't stop that. Because you do tell them all these bad things and you're like, okay, hey, you're not doing X, Y, Z, but you are doing A, B, C. So that's my big thing as an inspector. I want to educate and work with them. I don't want to be against them.
Well, that's very important that you
Yeah.
say that because, again, being a small town, we need business in our town. We don't want to run business out of our town.
Yeah.
We want to be helpful. That's a very important part of your job, our job, is to be there for them. And if something isn't right, we can address it, you know, to the best that we possibly can.
Yep.
We have situations where we have in town, I don't know if you're familiar with Breezy Bend.
I'll be there tomorrow with their
Yeah.
snack shack.
Right. Very neat, very clean. I mean, I'm not an inspector, but for me to go in there and see it, it's like they really, you know, make an effort to do the right thing.
Yeah.
Yes, they do have some things that are, you know, have to be addressed, but for the most part, they do a good job. I guess my point is this, going back to what I first said. We're not trying to drive people out of town. We're trying to help them. And if they understand that, they'll be more than willing to do the right thing, you know.
That's my hope. I don't want them to say, oh, bumped out the health inspector.
Oh, here
I
she
want
is.
them- Yeah, I want them to be like, oh, okay, she's here, no big deal.
Yeah,
She's
right,
fine.
right.
Like,
Yeah,
Yeah.
hi, Emily, you know.
Yes,
yeah.
not a, oh gosh, guys, okay.
Right. That's great, I like that. Anybody else?
Would it make sense to have her go through an inspection, a food inspection place with Dan?
No,
I've been doing food inspections already for
No,
Hartford
yeah,
and
I think-
Oxbridge.
I think she's fine.
All right, so you already worked with Dan?
I have, yeah.
Yeah.
Okay.
Yeah.
And the second one is, we had an inspection where a substantial amount of food was thrown out because it wasn't being stored at the right temperature. And that's probably not looked upon as being friendly. So if something like that came up, are you capable of saying, out?
I am, yeah.
I'm sure-
I can lay it down. I know I don't look scary, but I can be a little scary. It depends on
No, I mean,
depends what you're dealing
it's your
with.
job, you have to enforce
Yeah,
the law, and
yep,
like I say, if you present yourself, and I'm sure you do, present yourself in a manner that's not overwhelming and, you know, scary, boo,
yeah.
food inspector, but that's mainly it. I mean, how you present yourself to people. And a good example of that was Danielle. She was, you know, doing the job that you girls are doing now. She just had the right approach, and I think that I see that in you, both of you.
Thank you.
You have the right approach. I feel very comfortable after meeting you now. Yeah.
Thank you.
yeah. You're very welcome. Thank you.
Happy to help in any way.
Okay, great. So,
Make a motion or something?
yeah, if we make a motion, and then we can discuss if you'd like.
All right. I'd like to make a motion that we vote Jenna and Emily to act as agents in respect to their roles to represent the Douglas Board of Health.
Okay,
Second?
all in favor?
Aye.
Okay, any, open for discussion? Any?
Thumbs up.
All in favor up there? We're saying up because we're looking up. Okay. There's no offense. Okay, any discussion? Dave? Mary Ellen? No? Okay. All in favor?
No, not from me.
Okay. All in favor?
Aye.
Okay. Meeting is adjourned.